Good afternoon, and welcome to the Human Research Protection Program's Research Matters. I am Scott Myers, the Clinical Research Educator for UT Southwestern's Office of Research Regulatory Affairs, and I will be one of the moderators for today's session. I'm going to quickly go over some housekeeping items. If you have any questions for our presenters during today's session, please type them in the Q&A. One of the moderators will respond to you during the session, or we will address it at the end of the presentations. This session is being recorded, and you can watch it again right after it's finished by clicking on the Microsoft Teams live link in the email invitation. We'll also send you the slides via email, and you can find the links to future meetings, slides, handouts, and past recordings on the HRPP's Research Matters website under the Training and Resources page. We do provide a certificate of attendance for those who have logged in using valid email address. If you did not receive one via email but should have, please send an email to hrpp@utsouthwestern.edu to request a certificate. Lastly, we want to hear from you. We use the information you provide to plan for future topics you would like us to cover during these sessions. You may also let us know how our speakers did and how our office is doing, so please take a few minutes to complete the survey to provide your feedback. You may access the survey using your phone via the QR code or your computer by selecting the link. I will also drop the link for the survey in the Q&A. Okay, here is the agenda for today. First, Mayad Bird will provide updates from the IRB office. Kelechi Echendu will then present to you on REDCap and 21 CFR Part 11 compliance. We will then be hearing from Shannon Luck from the Office of Safety and Business Continuity, who will provide an overview of how to submit radiation procedures for SURE committee review and approval. Finally, Karen De La Fuente from our Regulatory Support and Monitoring team will present an overview of the essential documents required to be maintained in a regulatory binder during the lifespan of a study. And if time permits, we will conclude with an open Q&A session. So I will now turn it over to Mayad.
Good afternoon, everyone. So today I'm going to just provide a few IRB updates. So at the top of our list is our UT Southwestern ethos and our migration status. How are we doing? So we have completed our initial wave, the wave 1, which was the first wave for full board studies. That was completed on January 24th. We initiated and completed wave 2A, which included Reliant studies and again, some other studies that were in an approved or activated state were ready to be migrated, and that was completed on February 28th. We've now started our wave 2B, and that is in progress. We started that wave on March 5th. We are a little over 50% complete with that migration. This particular group was to migrate studies that fall under expedited review. And again, backfilling those studies where they were activated while we were working on the previous wave. So a little bit more to go on those. After we finish this particular wave, then we'll go back through and start finishing out things that need to come over in additional waves. So these are going to be items that had business items open during the time of migration and couldn't be migrated. So we'll go back in our final wave to work through those items. Speaking about single IRB review portal, and this was reported last time, but I just want to make sure it's at the forefront. The portal again has been provided to the office, has been provided, or I should say the product has been provided to us. We're still undergoing some testing with the SIRB portal. And again, with the testing, what we're trying to do is make sure that a lot of the issues that we're seeing in the main ethos platform are not going to be issues in the single IRB review portal. So we're working on those to ensure that the platform itself is stable and is functioning as best as we can get it before we open up the SIRB portal. Because the last thing we want is to have two systems that are not working well. Our clinical research units, CRU. Clinical research units, they used to be called departments, divisions. They're now also called clinical research units. but this could also be a clinical research unit, could also mean an institution. So if you were doing a study on behalf of Parkland, your clinical research unit would be considered Parkland. So there was an error with the Ethos system that when we had a change of PI or when we had a submission, some of those CRU notices were not going out to the appropriate individuals. So that has been fixed, and the department division or CRUs now receive a notification. We have created a tip sheet, and this QRC is going to link you to that tip sheet. This tip sheet is also available on our UT Southwestern SharePoint site. Sorry, UT Southwestern Ethos SharePoint site. I've also put a link in the slides when we release them to you all. The next thing is IRB deferral responses. So currently we've noticed that there is an issue with being able to respond to deferred studies. So again, deferrals are when the IRB is not able to determine that a study meets criteria for approval, a study needs significant changes. The system, again, is not functioning like we intended. You may submit and attach a document, but you cannot actually edit the SMART form. So we're going to ask as a workaround until we get this issue fixed in the system that you work with your regulatory specialist. And usually that's the individual who had sent you the letter. If you look at the history of your submission, that's the individual that sent you the letter. So you'll want to work with that individual to get the SMART form updated so we can get a response back to the board. Continuing review notifications. So a quirky thing that kind of happened with our continuing review is the first issue is that the continuing review notices were not turned on. So some of you all did not receive continuing review notices. The second issue was that during the migration process, your particular study might have missed one of those notifications. So you may want to look at your research studies that have been migrated or your research studies in general to ensure that they are not going to expire, or get your continuing review or annual update in before your study expires. The notifications are going out at 60 days, 45 days, 30 days, 7 days, 1 day, and then you should be receiving also a notification when the study is expired. There's an email that should have gone out today identifying the studies that are in a lapsed state, and then there are some that have kind of been on the list for a little while, given a deadline to submit the continuing review or annual update on those studies. Protocol Builder. So this is kind of a project that we've kind of delayed a little bit, but Protocol Builder is on track to be released to the research community for use mid-April of this year. The delays were centered around the fact that they themselves were undergoing a system upgrade. So we were signed up for version 1.0, but because there were going to be significant cost associated with trying to upgrade to 2.0, we decided just to delay that and allow for us to allow users to use 2.0. And it's got a lot of wonderful new updates, but we will next month provide training on how to use the program or the platform again. We will also be making training for the platform available in City Program by opening up a module that you can sign up for and conduct on your own time. Again, we'll do a short demo in next month's Research Matters session. So more to come on that. And then finally, and then this is probably a good segue into what Kelechi is going to be talking about today. We have posted on our website. This is more of guidance and that I'm sharing with you all, but there's a guidance document that should be posted sometime today or tomorrow that talks about electronic informed consent platforms. And this is really just here to help you understand, you know, the systems that we have available for use, the REDCap, DocuSign, iMedConsent, and Adobe Sign. We have these platforms available, and this matrix allows you to understand when you can actually use e-consent or when it's not appropriate to use a certain platform. For example, we have a normal REDCap system. You can use e-consent, but if you are conducting a FDA regulated study, you're not going to want to use that version of REDCap. You're going to want to use the REDCap Part 11 version. Same thing with DocuSign. There's a DocuSign that is Part 11 compliant. So again, you want to make sure that you're taking into consideration the items that you or your study and the the study itself and whether it's regulated by the FDA, and also considering the appropriate platform for e-consent. With that in mind, that is all that I have to report for today. I'm going to turn things over to Kelechi.
Okay. Hello, everyone. We're excited to announce that the UT Southwestern REDCap is now 21 CFR Part 11 compliant. It is live and ready for use. So this presentation will outline the requirements for study teams to ensure compliance, particularly for study teams working on FDA-regulated research. All right, so what is 21 CFR Part 11? 21 CFR Part 11 defines the criteria under which electronic records and electronic signatures are considered trustworthy, reliable, and equivalent to paper records and handwritten signatures. It also establishes the regulations on electronic records and electronic signatures for FDA-regulated studies. So to ensure compliance, the UT Southwestern REDCap Part 11 team reviewed the REDCap system against all Part 11 requirements and developed a training module to ensure compliance for REDCap electronic records. The training modules were developed for clinical investigators requiring Part 11 compliant electronic data capture software application for FDA-regulated research. The UT Southwestern instance of REDCap is compliant for electronic records, electronic data capture, and e-consents with physical signatures using a stylus or a finger to hand draw the signature. Please note that UT Southwestern REDCap is not compliant for electronic signatures where the signer clicks a button to electronically apply a signature. Some important instructions. First, ensure the project is an FDA-regulated research project which requires Part 11 compliance. You may check with the IRB office for confirmation. PI and study team members working on an FDA-regulated research are required to complete the Part 11 training module. A certificate will be available upon completion. Any additional users added after the project is live are required to complete training before they are added to the REDCap project. Once training is completed, you may proceed to create your new Part 11 project in REDCap. A REDCap admin will verify that all users that are being added have completed training. Training is required, and not doing so will be considered non-compliance. So this is the process to create the project in REDCap, the Part 11 project in REDCap. Once training is done, you log in using your UT Southwestern user ID and password. Then you click on New Project. Then you complete the REDCap project creation form by entering the required information as shown, starting with the study title, the project purpose, which will be research. That's what you will select, PI name, STU number. And then the second selection here under please specify, you would select clinical research study or trial. And a very important part of this form is entering Part 11 project in the project notes. This is to ensure compliance with 21 CFR Part 11 requirements. Then you create your project as desired and submit to the REDCap admin for approval. The REDCap admin will validate the project and confirm that all users have completed the training. Then you receive a notification that the project is live. As previously mentioned, any additional users added after the project is live will be required to have training. Training is required, so please ensure to do so so that not to be considered non-compliance. Compliance with training will be monitored by the Office of Institutional Compliance. If you have any questions, please reach out to the REDCap admin with this email address. All the information outlined in this presentation is also available on the REDCap Part 11 SharePoint site. And the tip sheet on how to create your Part 11 project is also available on our website. This will link directly to its location. Any questions? All right, I will pass it over to Karen.
Hi, we're actually going to pass it over to Shannon. Hi, I'm with the Office of Safety and Business Continuity. Today, I am going to be going through the REDCap survey for submitting your research study for SURE review and approval. We're going to assume that everything is always approved right away, right? Because that's how we want it. So thank you for giving me this opportunity to meet with you all today and kind of go through this. I understand that there's been a big learning curve with everything, and to throw this on top of it all has made things kind of confusing. So thank you all for being so patient and kind of going along with us while we were implementing this form for your use as well. But hopefully many of you have learned that there are a lot of advantages to using the REDCap survey for our SURE process, and you'll be able to submit your studies much faster in the future. So on my screen here is basically what the survey opens up to. It goes through a brief synopsis of what the SURE committee does. Then there's a brief section of instructions. It's very important to note that this is not for submitting any MRI exams that are part of your research study. This is only for ionizing radiation studies. And then if you have any questions or run into any issues at any point, you're always welcome to reach out to the SURE committee at utsouthwestern.edu, and we'll be sure to answer those questions for you. So I'm just going to go through and fill out a temporary study. We're just going to make one up here, just so I can show you what it is. So obviously the study ID is pretty self-explanatory. You're going to enter in your study ID. If this is part of a modification for a study that was previously approved, you would select yes, and it gives you the opportunity to tell us what that modification number is. But for today, we're going to say no. This is where you're going to enter in your study title and information pertinent to your study. Right? So most of this you guys can see is pretty self-explanatory. The research coordinator here, this is going to be the person that's entering in this study. This is very important because the person who is entering in this study is the person who's going to have access to the submission after you turn it in. It is possible to share that with others on your study team if you intend for someone else to help fill in some of the questions, or if, say, you're going to be out on vacation and the stipulation letter comes through, there is a way to hand off that process. But the person whose email is entered in here is the one that gets all the communications from our SURE team. So we're going to say that the study is being performed at UT Southwestern just for demonstration purposes. For this, we're not going to have an authorized user. We're going to put in our study duration. We're going to pretend like all those say years after it. Will females be studied? If you say no, nothing happens. But if you say yes, then it goes through what we would suggest education is included for your childbearing patients or childbearing female patients. So we're going to say yes. Will screening be appropriate? Yes. Is the medication FDA approved for this demonstration? We're going to say not applicable. If you were to say yes, it does give you information that you do have to fill out. But for this, we're going to say not applicable. Indicate which one is true. Here, indicate which is true. The description and manufacturer provided depictions. This doesn't happen too terribly often. So for this, we're going to say not applicable. And this is the fun part. This is where you are going to go through your protocol or your imaging manual to tell the SURE committee what types of radiation studies the patient may experience as part of either standard of care or research. So for today, we're going to do an x-ray of the chest. We're also going to do a CT scan, and we'll go down and select that here in a second. But as you can see, whenever you select the type of study or the type of procedure here, it opens up a whole other section down here in this that needs to be filled out. So for our x-ray, we're going to do a chest x-ray, and let's do an abdomen or KUB. So you can see each time I click on one of those, something else populates to the right of that. And we tried to make it as simple as possible. So these grayed out these placeholders that are entered in each section of the study. We're basically trying to give you the answer ahead of time. So the number of chest CT exams, we're going to say we're doing 1. The number of research chest x-rays, we're going to do 2. And you probably have noticed if you've already entered in a survey before that we are changing our dose measurements. So we're no longer recording everything in millirem. We're going to record it in millisieverts. And the reason that we decided to do that was because millisieverts, the measurements are equivalent, but millisieverts we can measure at a much lower number versus millirem. So it's much easier for you to calculate and for us to calculate. But when it comes to calculations, we decided to make it even easier for you. So for your dose per procedure, we actually put the answer in for you right here. So the chest equals 0.05 millisieverts. And all you have to do is type that in. Once you hit go to the next section, it automatically calculates what your total research dose is going to be. So essentially it's taken the number of research exams and multiplied it by the dose per procedure to tell you what the total research dose is for that one exam. So here for the abdomen, we're going to say we're doing 5 standard of care. Actually, let's just have some fun. We're going to do 0 standard of care. We're going to do 5 research. And again, for an abdomen KUB, your millisievert is 1.4 here. I'm going to click on the next thing, and it automatically calculates my total research dose. So down here for the chest, let's do a CT chest of the angiogram. And actually, I'm just going to click on a couple different things just so you can see. We do give you the answers, so you don't have to keep up with, wait, which one did I select first? Which one did, which box does this go to? Which one does this go to? It gives you the answer as a placeholder in that section. So we don't want you to have to remember all that. So if you're watching what those placeholder notes are for you, it'll lead you to the correct answer. So we're going to do 2 research chest angiograms. The millisieverts for that is 25 each, and it's automatically calculated it for us here. If there is a study, an x-ray study or a CT study, anything here that we don't have the procedure listed out for you, you do have the opportunity to click other. You type in the name of the x-ray procedure. I'm just going to put knee just for fun. You do the type of, the number of standard of care, the number of research, and then here, obviously, we don't know what you're filling in, so that we might have to get you a dose. And for that, I would suggest either referring to the adult chart on the SURE webpage, or you can send an email to that SURE committee at utsouthwestern.edu. But for the demonstration, we're going to take that off. So those are all the imaging studies that we're going to be doing as part of this particular study. You will notice that we have nuclear medicine diagnostic section here, but then there's also a nuclear medicine therapy section here. So the difference is in the title. If the nuclear medicine study is going to be part of a therapy exam, you would enter that information down here. If it's just part of an imaging study that we're going to be looking for, you would enter it in here, up here and under the diagnostic section. So then our next question, does the research study involve any other x-ray procedures not listed above? If I were to say yes, it'll ask me how many other x-ray procedures. You can select up to 3. If you have more than that, please send an email to the SURE committee and we'll help you figure that part out. But it would be the same thing here. You're going to enter in the procedure name, the number of standard of care, the number of research. We will assist you in getting the dose per procedure, but then after that, it should calculate it for you. For the demonstration, we're just going to reset that and say no. So for this, we're using standard of care exam parameters just for the demonstration. I'm not going to do anything special as far as my chest x-ray goes or my angiogram goes. So just whatever the facility is using. And then again for, I'll show you real quick. Let's do a linear accelerator exam. How many exams are included in this particular study? We're going to say 1. And then in here, we have you select the procedure name. And then this part pretty much stays the same as what was on the previous SMART form as far as the number of fractions, the dose per fraction, whether or not there's going to be a boost dose, and the total effective dose for the procedure. This is the only one where, actually, I think it does calculate it for you. There you go. So it calculates that for you there as well. You don't have to do that. Then we do provide you a section to describe any variation from the standard of care on the dose or the boost dose delivery. So again, we give you basically examples of what kind of information we're looking for in this section. So it comes in real handy when you're filling out your own research study. So for this right now, though, I'm going to reset that. We're going to say not applicable. We're not doing anything there. So the next section, sorry, I don't mean to scroll back and forth, the radiation risk statement. So you can see the total research dose related for diagnostic procedures, it comes up to 57.1. And you may be asking, where did I get that 57.1? Well, it actually came from what was auto-calculated in your top sections here for your x-ray procedure. We basically totaled that and put the answer for you right here. So then the next section is this research study part of an outside IRB? And we're going to say no. If you were to say yes, that's really all the information that we need, and you can go on to the next section. But for this one, we're going to say no. The next question after that, yeah, I see that we have a lot of questions. Thank you, Erica. I'll go through them as I'm after I get through this part of it. But I love all the questions, so thank you. Keep them coming in. So let's see, choose the correct option based on this particular research study. So if it's for standard of care only, say that means that I'm going to have a 1 here and a 0 here for my research. And the same thing here, 0 research exams, then that's where you would select standard of care imaging exams only. For this particular study that we're doing, it does involve research. So we're going to select that. And now you can see this gives you the consent statement that is required by the SURE committee. So our dose is greater than 50 because we have the 57.1 here. And so basically when we open up your consent, this is the consent statement that we want to see, or the SURE risk statement that we want to see in your consent. So we try to put it there for you so that way you don't have to go hunt for it or figure out which one you need to use. So just for fun, let's just say I'm only going to do 1 angiogram. And so that lowers that down to 25. My dose is now 32.1, which makes it less than 50. And you can see when I went up and changed that and when I scrolled back down, everything automatically adjusted based on the numbers that I had. So as long as your information up here is correct as far as the number of standard of care, number of research, it'll tell you which consent statement the SURE committee is going to require in your consent. So you basically are selecting that, saying that's the statement I'm putting in my consent. We're going to upload a copy of our imaging manual. So when you select that, you're going to choose your file, and wherever you have this saved, you can grab it from there. Let's do here. Here's my consent for this one. Oops, I did the wrong one. So see, I can remove that. Let's do my imaging manual here. There we go. We're going to do our consent. Hopefully your consent is a lot more detailed than what mine is right there. And then the other thing that we need you to do at this point is basically to take a copy of your survey here and to upload it right here. So we give you a couple different ways that you can do that. So we could just do a simple right click and print. And I'm going to save it as a PDF. And for this, I'm just going to save it to my P drive. So this is what it would name it. You don't have to name it anything differently, as long as you know what you're looking for when you go in to upload it. So I'm going to go upload it here now. There it is. I'm going to upload that. And then if there are any other copies of any other documents or anything else that you feel would be pertinent to help the SURE committee do the review and provide approval, then we give you the opportunity to do that. If you're uploading any of these and you have multiple documents that you would like to upload, there's no limit to the number of documents that you can upload. Just for today's example, I just selected the one. And then after that, I would hit submit. So I'm going to take a quick pause before I go on to the next section. Let's see, what about existing projects? Okay, hold on. I'm going to keep scrolling. Could you add any information about what an authorized user may be? And if I missed anything up above that that was pertinent to me, please tell me to go back. Okay. An authorized user is going to be someone that is listed as an authorized licensee or on the state of Texas registration to be able to handle radioactive materials. So if you have a therapy study that is going to be using tritium, the authorized user is going to be licensed through the state of Texas to be able to handle tritium. So if you don't, I almost want to say it's one of those things, if you don't know what it is, you are not going to have an authorized user, but that's typically what it is. If your research study is handling a radioactive material, there must be an authorized user that's associated with it because they have to be licensed in order to be able to handle that material. And please feel free to add another question if that didn't make sense. If the study expiration date is next week and the CR submitted this week, will that be an issue? I don't know that that's for me. If it is for me, I don't know. Please help me provide some clarification for that. Okay, Erica, am I missing any other questions for the REDCap survey?
We do have some questions.
Yeah.
Under the new tab. So it's saying for SURE submissions when selecting number research.
Oh, here we go.
What is this based on? Is this based on the coverage determination that drives billing or based on whether the exam is considered extra just for research purposes?
Yeah, I think that's $1 million question, right? And that's where it can become kind of confusing when you're reading through the imaging protocol or manual. So if it's a research study, we consider that above and beyond what the patient would normally get as part of their standard of care. So if the patient is going to have a chest x-ray to follow up on the status of the procedure that they had done the week before, if the physician would normally order that chest x-ray as a follow-up, regardless of whether or not they were involved in that research study or not, then that's going to be considered standard of care. If the physician is only ordering this chest x-ray because they're in this research study, then that would count as a research exam. And I know that part can be very confusing. So if at any time you have any questions about that, I mean, by all means, reach out to the SURE committee or reach out to me, and we'll see what we can do about providing some guidance for you, because I know it can be very, well, like I said, it can be very confusing.
There is another one. So will the charts on the SURE website be updated regarding the change from MREM to MSV?
Yeah, so let's pull this up real quick because I do want to make sure that one, everybody knows how to find it, and two, that way we can see what the updates are. So I just clicked on the wrong tab. So if you're on the utsouthwestern.net page, and we do have this available on the .edu page. Go to radiation safety here. And of course, now that I'm presenting, it's going to take forever. There we go. We'll go to the radiation subcommittees. There we go. So we have the SURE subcommittee here. You'll click on that. And then the adult diagnostic exam table. Most people, I believe here, are pretty accustomed to looking for this one. but if you go to the adult diagnostic exam table, it does have the millisieverts recorded here. We did keep the millirem on there just because we do have a number of studies that still live in IRB, and we're working through the IRB system, but in the Ethos system and anything done through REDCap, we'll use the millisieverts.
Okay, let's see. Okay, next question. What does activity refer to in the nuclear medicine table?
Yeah.
Anything helpful? Any extra context would be helpful.
So if you have a nuclear medicine study and the activity here, that your protocol manual is going to tell you what that specific activity is. So it's usually related to the isotope that you're using. So let's say that we're using Y90. The activity is going to be related to how much of the Y90 is being used. So that will be included in your imaging manual. If you have to guess at it, then they haven't provided the information that you need. You can reach out to us and we can help you, or we can, or you might have to refer back to your, vendor. I'm totally gonna blank. Regulatory contact, yeah.
Okay, all right. We do have some more questions, but to move
Yeah.
the presentations along, I'm
Agreed.
going to turn it back over to you.
Yeah, absolutely. So once you hit submit, let me pause for 1 second. Say for some reason you don't have the consent ready, or you need to go back and add that verbiage to your consent. So we're not ready to turn that part in, right? But I do have everything else ready. I don't want to lose this information. I can save my survey and return to it later. One thing that we have started seeing is that some people will start to enter their SURE survey in for review, and then for whatever reason you have to leave it. And when you come back, rather than going back to your original one, you start over. So we're seeing some duplicates in there. If you did hit save and return later, and then you're like, okay, I have everything for my consent done now, then go back to your original submission, and then you can just upload your consent at this point. If there's anything else that you have to save and return later for, just be sure that you go back to that original. But let's say for this instance, I'm going to go back and put in my consent, and then I'm going to submit it. Oh, let's see. I didn't provide an answer here. So see, it told me that I needed to provide a value for one of these questions here. So subjects will be exposed to the following types of radiation therapy. So it's telling me that I need to go back and take care of that. So I'm going to come back here to my therapy section and hit not applicable. And now I can submit it. So you will get, you should be getting a email confirmation that tells you that we have received your SURE committee review. It should also have a link to go back into your submission, so that if you do receive a stipulation letter from the SURE committee, you'll use that link to go back into your original survey and meet those stipulations, and then you can hit submit again. If for some reason you don't get that link, or that link isn't working, if you just reach out to the SURE committee at utsouthwestern.edu, we can resend you the link, and every now and then there's an access code, and we can provide that access code for you as well. The same thing goes if you're on a team and say you have a coordinator that submitted your SURE survey, but they're out on some kind of extended leave that was unforeseeable, and now you need access to the survey that they submitted. Same thing, if you just reach out to the SURE committee at utsouthwestern.edu, with the study number, we can provide you that same link and access code, so that way anybody else on your team can go back and pick up where that original coordinator left off. That is pretty much everything. I think it's just really important to remember that if you do get a stipulation letter, go back to your original survey submission and make your changes on that original. And if you have any questions along the way, rather than just leaving things blank or putting erroneous information. If you reach out to us, we really are happy to help you go through your protocol manual and find the answers that you need to submit for your survey, because we want to make things easier for you too. We understand a lot of times everybody ends up in a little bit of a time crunch, and we want to avoid that as much as possible. So that's everything I have.
Good afternoon. My name is Karen De La Fuente, and I am one of the regulatory monitoring analysts with the Quality Assurance and Monitoring team. Today, I am going to briefly discuss essential and regulatory documents for clinical research trials. Why are essential documents important? Essential documents are those documents which individually and collectively permit evaluation of the conduct of a trial and the quality of the data produced. These documents serve to demonstrate the compliance of the sponsor, and monitor with GCP standards and with all applicable regulatory requirements. A regulatory binder is created at the beginning of the trial, both at the investigator site and at the sponsor's office. For industry-sponsored studies, maintaining the regulatory binder in real time can greatly assist in the successful management of a study and ensure that the study is always audit ready. Non-compliance with maintenance of essential documents can damage the clinical trial's integrity, risk the validity of the data produced by the trial, risk subject safety, and damage the PI and institution's reputation. Essential documents that should be maintained by the study site include current and all previous IRB-approved protocols, current and all previous investigator brochures and package inserts for greater than minimal risk studies, current and all previous IRB-approved consent form, assents, and HIPAA forms, signed and dated CVs for PI and sub-investigators for minimal risk studies, signed and dated CVs for all IRB-approved study staff for greater than minimal risk studies. CVs should be updated as needed, but at a minimum every 2 years. Valid medical licenses, protocol-specific training documentation, and GCP HSP certificates that confirm that the study staff is qualified and trained to perform delegated tasks. Logs including delegation of authority log, screening log if a trial pre-screened subjects to determine initial eligibility, enrollment log if enrolling and consenting subjects, tissue log if tissue samples are collected and shared, protocol deviation log, adverse event log, accountability log for trials involving drugs and/or devices, IP handling log for trials involving shipment or transfer of IP. Template forms used to collect study data, for example, demographic sheets or CRFs. Copies of significant correspondence with the sponsor for studies that are funded externally. These include Dear Investigator letters, SUSAR reports, enrollment activation letters, enrollment suspension or enrollment hold letters, memos, newsletters, monitoring visit confirmation and follow-up letters, and monitoring visit tracking logs. Other essential documents include FDA 1571 and 1572 forms. For PI sponsor studies, which are studies where the PI or UT Southwestern investigator is the IND holder, a current signed 1571 and 1572 are required. For sponsor IND studies, only a current signed 1572 is required. Additionally, financial disclosure forms should be filed for the PI and all sub-investigators listed in the 1572 for both PI sponsor studies and sponsor IND studies. For studies involving labs, CLIA certificates, CAP certificates, lab director CVs, and normal lab reference values for each laboratory use should be filed. The following IRB-related documents should be filed: initial IRB approval and submission, IRB approval letters for all modifications, continuing reviews, and/or reportable events, IRB approved study tools such as surveys, questionnaires, recruitment materials, and filling email scripts, IRB notifications, and investigator responses to the IRB. Lastly, progress reports, reviews, recommendations, and correspondence for oversight committees such as DSMB, DMC, or safety officers should be maintained by the study team. Essential documents to be filed in the subject binder include eligibility checklist signed by the person completing the checklist, and for a majority of the cases, the eligibility checklist should be verified and signed by the PI. Sign and data informed consent form, assent, and/or HIPAA forms, documentation and informed consent process, completed and accurate data collection sheets and/or case report forms, progress notes if applicable, lab reports assessed for clinical significance by the PI or sub-I if applicable, note to files if needed, and logs including adverse event logs, comment logs, and protocol deviation logs. QAM resources. I have linked the Quality Assurance Monitoring Office main page. If you have any questions, you can also contact us at hrpp monitoring@utsouthwestern.edu. And there are also virtual open office hours every Tuesday and Thursday from 10 a.m. to 11 a.m. Thank you.
All right, everyone. So that concludes the presentations. And now we're going to move into our open Q&A session. I invite you to submit any questions or comments that you may have at this time. And I'm going to pause for a few seconds to allow you time to type up any questions. While we're waiting for you to get those questions typed up, I just want to remind you of the survey. If you can just spend a few minutes to complete the questions, we will use the information to improve the content of these sessions and our presentation of them. We will also be able to see what areas we need to work on in the office and what areas we are excelling in. I'll just give everyone another minute here. Okay, I don't see any questions. You can still always reach out to us. But I want to thank all of our presenters and thank you all for attending today's session. Our next Research Matters session will be on April 15th. So please have a great rest of your week. Thank you.